Good afternoon. This is All India Radio. I'm Anuja Kumar, and with me is Anita Anand with the Midday News. The headlines. Government intensifies efforts to supply medical oxygen throughout the country. 50 metric tons of medical oxygen to be provided by the fertilizer plants on a daily basis. Over 14 crore 78 lakh people inoculated with COVID-19 vaccines in the country so far. More than 2,61,000 people recover from COVID-19 in last 24 hours. Over 3,60,000 fresh cases reported in the country. ICMR intensifies efforts to enhance availability of COVID-19 testing kits and newer innovative testing solutions in wake of spike in new COVID-19 cases. Centre provides nearly 16 crore doses of COVID vaccines free of cost to states and union territories. NCT of Delhi Amendment Act comes into force. From now on, city government to seek opinion of the Lieutenant Governor for any executive action. 6.4 magnitude earthquake hits Assam this morning. No loss of lives reported. And in IPL cricket, Chennai Super Kings to take on Sunrisers Hyderabad this evening. As the number of COVID cases is on the rise again, we appeal to our listeners not to lower their guard, take all precautions, and all those above 45 years of age to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. The government has intensified efforts to boost the supply of medical oxygen in the country. The union government has informed that 50 metric tons of medical oxygen will be provided by the fertilizer plants on a daily basis in the coming days. This move will augment the medical-grade oxygen supply to the hospitals in the country. The Ministry of Chemicals and Fertilizers has informed that Indian Farmers Fertilizer Cooperative Limited is putting up an oxygen plant having capacity of 200 cubic meters per hour in its Kallol unit in Gujarat. The plant's total capacity would be 33,000 cubic meters per day. In addition, Gujarat Narmada Valley Fertilizers and Chemicals has also started supplying liquid oxygen. The ministry has also informed that the other fertilizer companies will set up medical oxygen plants in hospitals. The decisions were taken in the meeting chaired by Minister of State for Chemical and Fertilizers, Mansukh Mandavia, to explore the possibilities of production of oxygen in the plants operated by the fertilizer companies. The minister asked the fertilizer companies to increase their oxygen production capacities and augment the supply of medical-grade oxygen to the hospitals. Defence Research and Development Organization, DRDO, will set up 500 medical oxygen plants within 3 months under the PM CARES Fund. Defence Minister Rajnath Singh informed that the medical oxygen plant technology developed by DRDO for on-board oxygen generation for light combat aircraft, Tejas, will now help in fighting the current crisis of oxygen for the COVID-19 patients. The minister appreciated the DRDO for using its technology to generate the much-needed oxygen for COVID-19 patients, which he said will help in overcoming the present crisis.
Civil Aviation Minister Hardeep Singh Puri has said that Air India is going to airlift 10,636 oxygen concentrators manufactured by Philips from various countries. In a tweet, the minister said that such 636 concentrators have already flown in from US to India. He said the consignments are flying in every day and the whole task will be completed within this week. Madhya Pradesh Chief Minister Shivraj Singh Chauhan has said that large oxygen plants are to be set up in all divisional headquarters of the state. He was addressing a review meeting with the core group regarding prevention and arrangements for containing the spread of COVID-19. The state reported 13,417 fresh COVID cases yesterday, while 11,577 patients recovered from the infection. More from our Bhopal correspondent.
Chief Minister informed that the availability of oxygen in the state is continuously increasing. Meanwhile, the number of active cases in the state rose to 94,276, with 98 patients succumbing to the infection. The death toll reached 5,319. Both Indore and Bhopal have more than 13,000 active cases. The growth rate of infection cases in 8 districts of Shahjapur, Panna, Agar Malwa, Umaria, Katni, Rajgarh, Anuppur and Guna has decreased. Under Kill Corona campaign, 12,800 survey teams are doing survey work in the state. Pooja Pivardhan, AIR News, Bhopal.
Maharashtra Health Minister Dr. Rajesh Tope has said that the state needs to appoint oxygen nurses to curb wastage of oxygen and to maintain data of oxygen storage at hospitals. He gave the example of Nandurbar district, which adopted the good practice of appointing oxygen nurses in the year 2020. He said the Maharashtra government has decided to appoint oxygen nurses due to the widening demand-supply gap for oxygen. The primary job of the oxygen nurse is to monitor the requirement of oxygen every 2 to 4 hours, round the clock, its use among patients, and to ensure minimum wastage. Instructions has been issued to all government medical colleges and hospitals to set up a dedicated team of nurses. Earlier, one nurse was attending to 45 to 50 patients, but in future, one oxygen nurse will attend to 15 to 20 patients. In Maharashtra, the tribal-dominated Nandurbar district has taken the lead in producing oxygen from the air and has taken steps towards becoming self-sufficient in oxygen. We have more from our correspondent.
The Nandurbar District Hospital of Maharashtra has the honor of constructing the first project in North Maharashtra to produce oxygen from the air in October 2020. Work has now been started on a jumbo project that will supply oxygen to an additional 300 beds. At present, Nandurbar District Hospital has 2 government oxygen production plants which produce 250 jumbo cylinders of oxygen daily. 278 beds are supplied with oxygen. The third project has begun with 60 jumbo cylinders of oxygen daily production. A third oxygen generation project is being set up in the district hospital premises as per the need. It has the capacity to supply oxygen to 300 beds at a time. It is expected to be completed soon. Bhavna Gokhale, AIR News, Mumbai.
The Indian Army has stepped up the hospital facilities at Delhi cantonment to fight COVID surge. A COVID facility has been created at Base Hospital, Delhi cantonment, where the entire hospital has been converted into a COVID hospital. At the start of the current COVID wave, the Base Hospital catered for 340 COVID beds, of which just 250 beds were oxygenated. This is being expanded to 650 COVID beds, of which 450 beds will be oxygenated by the 30th of this month. The ICU is also being enhanced from 12 beds to 35 ICU beds by tomorrow. The next phase of expansion will see the present capacity being augmented to 900 oxygenated beds by the second week of June. For efficient patient management, a new COVID OPD under a specialist medical team is functioning round the clock. This team clinically examines approximately 500 patients on a daily basis. The Indian Council of Medical Research has intensified its efforts to enhance availability of COVID-19 testing kits and newer innovative testing solutions amid the rising cases of COVID-19 in India. ICMR has proposed to exempt several reputed global agencies from validation criteria for RT-PCR, RAT, home-based testing solution, antigen, antibody ELISA, and rapid antibody tests. It further proposed to accord marketing permission by Drugs Controller General of India on the basis of existing approvals. Several global agencies of Europe, Japan, South Korea, Australia, Brazil, and the agencies listed in the World Health Organization's emergency use listing will benefit from this move. At present, kits approved by the U.S. Food and Drug Administration under regular or emergency use are exempted from validation in India. It qualifies for direct marketing permission from the Drug Controller General of India.
The Union government has provided nearly 16 crore doses of COVID vaccines to states and union territories free of cost so far. Of this, the total consumption of doses including wastages is over 14 crore 89 lakh. The Ministry of Health and Family Welfare has informed today that more than 1 crore doses of vaccines are still available with the states and union territories. The ministry has assured that more than 57 lakh vaccine doses will be provided to states and union territories within the next 3 days. On the alleged shortage of vaccines in Maharashtra, the ministry has clarified that over 1 crore 58,000 doses of vaccines have been received by Maharashtra so far. Of this, the total consumption, including wastage, was over 1 crore 53 lakh. The ministry said a total of 5,06,319 vaccine doses are still available with the state. It added that 5 lakh doses of vaccine will be delivered in the next 3 days. The Health Ministry has said vaccination is a crucial pillar in the fight against COVID, and the third phase of COVID-19 vaccination will be implemented from the 1st of May. The Ministry has informed that over 12,92,000 doses of vaccines are available in Uttar Pradesh, followed by Bihar, wherein 9,41,000 doses are left. The world's largest COVID-19 vaccination drive is progressing smoothly in the country. The Health and Family Welfare Ministry has informed today that over 25,56,000 doses of COVID-19 vaccines were administered to the beneficiaries in the last 24 hours. The ministry said over 14 crore 78 lakh people have already been inoculated with the vaccines in the country so far. From the 1st of next month, which is also the third phase of the largest vaccination drive, everyone above the age of 18 years will be eligible to take COVID vaccines. The registration for the third phase will begin from 4 p.m. this evening on the Co-Win portal, Arogya Setu app and Umang app.
The country registered the grim record of the highest number of fresh COVID cases and deaths due to the virus today. The record spike in coronavirus cases has increased the active caseloads in several states and union territories. The Health Ministry has informed today that over 360,000 fresh cases have been reported in the country within 24 hours. This is the highest number of cases registered in a day since the outbreak of the pandemic in India. The ministry has informed that at present there are over 29,78,000 active cases in the country, which comprises 16.55% of the total positive cases. The recovery rate now stands at 82.33%. The ministry has said more than 261,000 people have recovered from the infection in the last 24 hours. So far, over 1 crore 48 lakh patients have already recovered from this infectious disease. The Health Ministry has said over 3,293 deaths have been reported in the country within 24 hours, taking the toll to over 2 lakhs across the country. This is the highest number of deaths registered in a day since the outbreak of the COVID-19 pandemic. One dose of the Pfizer or AstraZeneca vaccine reduces the chances of someone infected with coronavirus from spreading it to other household members by up to 50%, according to a study published today. The Public Health England PHE research found that those infected 3 weeks after receiving their first jab were between 38 and 49% less likely to pass the virus on to their household contacts than those who were not vaccinated. British Health Secretary Matt Hancock said that we already know vaccines save lives, and this study is the most comprehensive real-world data showing that they also cut transmission of this deadly virus. The study drew data from over 57,000 contacts in 24,000 households in which there was a lab-confirmed case that had received vaccination compared with nearly 1 million contacts of unvaccinated cases. You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Government intensifies efforts to supply medical oxygen throughout the country. 50 metric tons of medical oxygen to be provided by the fertilizer plants on a daily basis. Over 14 crore 78 lakh people inoculated with COVID-19 vaccines in the country so far. More than 261,000 people recover from COVID-19 in the last 24 hours. Over 360,000 fresh cases of COVID-19 reported in the country. ICMR intensifies efforts to enhance availability of COVID-19 testing kits and newer innovative testing solutions in wake of spike in new COVID-19 cases. Centre provides nearly 16 crore doses of COVID vaccines free of cost to states and union territories. Entity of Delhi Amendment Act comes into force today from now on, city government to seek opinion of the Lieutenant Governor for any executive action. 6.4 magnitude earthquake hits Assam this morning. No loss of lives reported. And in IPL cricket, Chennai Super Kings to take on Sunrisers Hyderabad this evening. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
Welcome back to the Midday News on All India Radio. Assam Chief Minister Sarbanand Sonowal is holding a consultative meeting on COVID situation in Guwahati. Representatives of defence forces, oil companies, railways and airports are attending the meeting. Various measures to contain the situation along with other related issues are also being discussed. Amidst a spike in COVID cases, West Bengal accomplished vaccinating more than 1 crore people across the state. The Director of State Health Department, Dr. Ajay Chakraborty, said that over 1,89,000 people have been administered the vaccine doses yesterday. Around 86,000 got the first dose, while over 96,000 got the second dose. Private COVID vaccination centres have been asked to return their remaining vaccine stock after 30th of April, before the third phase of vaccination. They have also been directed to procure vaccine doses directly from the manufacturers. No on-site registration of beneficiaries will be allowed for private COVID vaccination centres, except for doses that are left out in the last open vials.
Telangana reported 8,061 fresh COVID cases during the past 24 hours. The state also reported 56 deaths due to COVID and other comorbidities, the highest on a single day. With this, the COVID-related deaths in the state increased to 2,150. The state government, in its COVID bulletin, stated that currently there are over 72,000 active cases in the state. The number of COVID cases reported so far in the state has gone up to 4,19,966. The recovery rate further dipped to 82.31% during the past 24 hours. 5,093 people recovered from the disease, taking the total number of recoveries in the state to over 3,45,000. The Chhattisgarh government has appealed to the public to donate money for the free COVID vaccination of people above the age of 18 years in the state, starting from 1st of May. A special campaign has also been started in this regard.
Chhattisgarh Chief Minister Bhupesh Baghel has said that the state government has completed all its preparation for the COVID vaccination for people above the age of 18 years. He said that orders have been placed for the total 50 lakh doses of Covishield and Covaxin with the respective companies. He said that the state government has decided to give COVID vaccine free of cost to the people of the state. In Chhattisgarh, the population of people between the age group of 18 and 45 years is about 1 crore 35 lakhs. About 1,000 crore rupees of expenditure is expected to be incurred for free vaccination of people of this age group. The Chief Minister has appealed to social organizations as well as general public that they can provide financial help in this work. Vikalp Shukla, AIR News, Raipur.
Odisha has reported a new high of 8,386 fresh COVID-19 cases today. With this, the total active caseload of the state has crossed 55,000. The state is all set to cross the mark of 1 crore COVID-19 sample tests, with more than 99,97,000 tests having been conducted as on date. More from our correspondent.
Having plateaued out at about 6,000 cases daily for about a week now, COVID-19 infection today soared across to a new high of 8,000 plus cases. Though the state also recorded a recovery of about half as many cases today, yet the current active case load at 55,245 is in itself a new high. While Khordha, the home district of capital Bhubaneswar, has reported the intraday highest of 1,840 cases, at least 15 out of the total 30 districts have come out with new cases beyond 200 each. Meanwhile, the state has already vaccinated more than 57 lakh beneficiaries, with the vaccination process still on across the state. Giresh Chandra Das, AIR News, Bhubaneswar.
In Maharashtra, the registration for the third phase of COVID-19 vaccination drive for citizens above the age of 18 years begins today. Vaccination will begin from the 1st of May. More from our Mumbai correspondent.
In order to get vaccinated in the third phase of vaccination, the eligible citizens are required to register by visiting the portal cowin.gov.in. The vaccine will be provided free of cost at central government vaccination centers. In this phase, vaccine manufacturers will supply 50% of their monthly production to the central government. These companies will be allowed to supply the remaining 50% to the states as well as in the open market. Meantime, Minister for Relief and Rehabilitation Vijay Wadettiwar has appealed to the youth to donate blood before getting the vaccine. Blood donation cannot be done for 2 months after vaccination. Madhuri Pange, AIR News, Mumbai.
Talking to AIR News, Dr. Anjan Trikha of AIIMS New Delhi has urged people to self-isolate themselves in case they get infected with coronavirus.
If you are infected and you are asymptomatic, so you have to see for yourself that you don't spread it to other people. So you go into isolation, do not sit with your friends or co-workers to eat food or to have tea or anything else, or sit together and watch a TV on the same sofa. Remain isolated in your room and stop going to your office or your place of work. If you are infected and you have any kind of symptom, you have named symptoms like fever and cough, so you should be on regular medications as per the doctor to take care of your fever round the clock, and you could be having some kind of a cough syrup so that your cough is suppressed.
Dr. Trikha said that double mask is important to combat COVID-19.
There are a lot of asymptomatic infected carriers in the society, so it is advisable that you remain wearing a mask in the home so that you can avoid getting infected. It is equally important that when you have household help coming into your houses, they should be wearing a mask and you should be also wearing a mask. Double masking is, as the word tells you, that you wear one mask and you wear the other mask over it so that every part of your nose and the face and the cheek is covered, and it prevents any kind of infected air getting into your nose and mouth.
All India Radio will broadcast a special interview with Professor Anjan Trikha, in charge COVID Centre AIIMS, in its bilingual news magazine Parikrama at 4:30 p.m. today. The interview can be heard in English in our program Spotlight at 9:15 p.m.
A team of researchers headed by Professor Manindra Agarwal of Indian Institute of Technology, Kanpur, has predicted that very soon the number of COVID cases will reduce in the country. Speaking exclusively to All India Radio News, Professor Manindra Agarwal and his team has said that cases have already started reducing in Uttar Pradesh and that the state has witnessed the peak of the epidemic.
उत्तर प्रदेश का आकलन मेरा ये है कि हम इस समय जो उच्चतम स्तर है केसेस का, उसको हम पार कर चुके हैं और अब हम नीचे जाएंगे. और ये पिछले 3 दिनों का यदि आप देखें केसेस का डेटा, तो उससे भी ये दिख रहा है कि धीरे धीरे नीचे जाना शुरू हो गया है.
Professor Manindra Agarwal said that as per their calculation, based on a special mathematical calculation named Sutra, it is clear that cases are reducing in Lucknow also, which has been the epicenter of the pandemic recently.
हमारे मॉडल के द्वारा ये निकल आ रहा है कि लखनऊ अपने उच्चतम स्तर को पार करके अब नीचे जाना प्रारंभ कर चुका है और आगे वाले दिनों में हम देखेंगे कि लखनऊ से केसों की संख्या लगातार कम होती जाएगी.
The centre has notified 27th of April as the date on which provisions of the NCT of Delhi Amendment Act will come into force. Now, government in Delhi means Lieutenant Governor. The city government will now have to seek the opinion of the Lieutenant Governor before taking any executive action.
An earthquake of magnitude 6.4 hit Assam this morning. No major damages have been reported due to the tremor in the state. The CEO of the State Disaster Management Authority, G.D. Tripathi, said that no casualty has been reported so far due to the earthquake, but few persons sustained injuries or report.
People came out onto the streets from their homes out of fear. Later, netizens took to Twitter and Facebook to share the damages. A few videos shows walls have collapsed, windows were shattered in several areas due to the impact of the earthquake. Another video has shown water seeping out from a paddy field at Narayanpur area of Chekiajuli, the epicenter of the tremor. The impact of the earthquake was so massive that a part of Bhairavkund Hill at Udalguri district was broken away. Manas Pratim Sharma, AR News, Guwahati.
Prime Minister Narendra Modi spoke to Assam Chief Minister Sarbanand Sonowal this morning regarding the earthquake in parts of the state. He assured all possible help from the centre and prayed for the well-being of people of the state. Home Minister Amit Shah also spoke to the Chief Minister to assess the condition in different parts of Assam after the earthquake. He said the central government stands firmly with the people of Assam.
In poll-bound West Bengal, all the necessary preparations have been finalized for the 8th and final phase polling for assembly elections tomorrow. The polling will be conducted from 7 a.m. to 6:30 p.m. The polling process is already over in respect of 257 out of the total 294 assembly seats in the earlier 7 phases. 35 assembly constituencies spread over 4 districts will go to polls in this phase. Along with this, a re-poll will be held at polling station number 126 of Sheetal Kuchi assembly seat in Cooch Behar district on the day. The counting of votes will be taken up together on the 2nd of May. Total 11,860 polling stations have been set up for this purpose. The Election Commission issued fresh poll notifications in respect of Samserganj and Jangipur assembly constituencies in West Bengal, where the poll process was adjourned due to death of the concerned candidates. The polling in these 2 constituencies will now be held on 16th of May, and the whole process of elections will be completed by 21st of May. Similarly, in case of assembly by poll to Pipli seat in Odisha, the polling will be held on 16th of May and the counting of votes will be taken up on the 19th of May. The Cabinet, chaired by Prime Minister Narendra Modi, has approved the signing and ratification of an agreement between India and the United Kingdom on customs cooperation and mutual administrative assistance in customs matters. The agreement would provide a legal framework for sharing information and intelligence between the customs authorities of the 2 countries. It would help in proper application of customs laws, prevention and investigation of customs offences, and the facilitation of legitimate trade. The agreement takes care of Indian customs concerns and requirements, particularly in the area of exchange of information on the correctness of the customs value, tariff classification, and origin of the goods traded between the 2 countries.
In IPL cricket, Chennai Super Kings will take on Sunrisers Hyderabad in Delhi today. The match starts at 7:30 p.m. Royal Challengers Bangalore RCB registered a thrilling 1-run win over Delhi Capitals as Mohammad Siraj defended 14 runs in the final over at the Narendra Modi Stadium in Ahmedabad last night. With this, RCB has moved to the top spot in the IPL standings with 10 points from 6 games.
Now let us take a look at the weather forecast for today. The national capital Delhi is expected to have mainly clear sky with minimum temperature recorded at 22 degrees Celsius. The maximum temperature is expected to reach 42 degrees today. Mumbai will have partly cloudy sky. Chennai will have partly cloudy sky with minimum temperature recorded at 28 degrees Celsius and maximum at 37 degrees. Kolkata will have mainly clear sky. Minimum temperature in the metropolis was 28 degrees Celsius, while the maximum is expected to go up to 38 degrees. In Jammu, the minimum temperature was 23 degrees Celsius, while the maximum will be around 39 degrees. The city will have mainly clear sky, becoming partly cloudy towards afternoon or evening. Srinagar had a minimum of 10 degrees Celsius. Maximum will be around 28 degrees. The city would have mainly clear sky, becoming partly cloudy towards afternoon or evening. In Leh, the sky will be mainly clear and the temperature will be hovering between 2 and 15 degrees Celsius. In Gilgit, the city will have mainly clear sky, and in Muzaffarabad, the temperature will shift from 15 degrees in the morning to 35 degrees Celsius in the afternoon. And now, before we end the bulletin, the headlines once again. Government intensifies efforts to supply medical oxygen throughout the country. 50 metric tons of medical oxygen to be provided by the fertilizer plants on a daily basis. Over 14 crore 78 lakh people inoculated with COVID-19 vaccines in the country so far. More than 2,61,000 people recover from COVID-19 in last 24 hours. Over 3,60,000 fresh cases of COVID-19 reported in the country. ICMR intensifies efforts to enhance availability of COVID-19 testing kits and newer innovative testing solutions in wake of spike in new COVID-19 cases. Centre provides nearly 16 crore doses of COVID vaccines free of cost to states and union territories. NCT of Delhi Amendment Act comes into force today. From now on, city government to seek opinion of the Lieutenant Governor for any executive action. 6.4 magnitude earthquake hits Assam this morning. No loss of lives reported. And in IPL cricket, Chennai Super Kings to take on Sunrisers Hyderabad this evening. And with that, we end the midday news.